virtually everybody does clench their teeth at night at times. And as I mentioned before, is how hard they clench, how often. Those are all more personal things. A lot of it's dependent upon their physical anatomy and physiology. Some is stress, some is just genetics. Now, the problem here is, so supposing this person comes in and they've got some teeth that are forcing their jaw out of position, meaning moving when they close their teeth completely closed, this ball and socket joint is not in the right spot. Now they go to clench really hard at night time. There's actually a disc in this area here between the ball and the socket, and it actually will move with your lower jaw. This is where it gets a little complicated to try to explain to patients, but very simply put, is that disc is designed to move, to accompany your lower jaw no matter where it goes. When you start clenching at night time and your jaw, we'll say for example, is forced forward, and now you're clenching really, really hard, that disc is whenever it moves out of the position where the ball and socket are supposed to be, when it moves out of that and then you put a lot of force on it, you start to cause damage, because as soon as that disc is out of that position, it's actually going to an opening position. For example, when you move your lower jaw forward, that is when you open really, really wide, you can actually put your hand here and feel your condyle go forward. That's because it's designed as an opening position. And when you go to the side, you'll also feel it move. So those are all opening or should we say, are most definitely not closing positions. So when you're actually forcing your jaws to move into an opening position, but are now clenching really, really hard at night without knowing, the best analogy I can give you, it's like if you go to sleep with your arms by your side, no problem. But if you go to sleep with your arm tucked behind your back, you're going to start having a lot of issues in your shoulder, which will then start causing muscle spasm, which can radiate through anywhere, into your neck, into your back, into your hands. It's simply because you're torquing tendons and creating a very unnatural situation that your body's just not designed for that type of movement. That's what's happening in the jaw joint when your jaw is out of its position and it's being forced to close really hard.